Can I have your attention, please? Good afternoon, everyone, and welcome. I'm Mayor Joseph Policino of the town of Johnston, and I want to welcome each and every one of you here today. No matter what city or town you come from, live in, we want to warmly welcome you to our great town and one of the best, I repeat, the best senior centers in Rhode Island. I'd like to thank Senators Reid and Whitehouse for coming to our town to answer questions on what is no doubt one of the most important pieces of legislation that we've seen, at least in my lifetime. I've been around a couple of years. I encourage all of you, if you have questions or concerns regarding health care reform, particularly this bill, then you ask your questions. But before we begin, I've been asked by the senators to introduce a Johnston resident who has a story to tell, Anna Bruditoria, and I'll be handing her the microphone. And just in case you're interested, the bathrooms, if you go through that entrance and to the left, that's where the bathrooms are. So once again, on behalf of all the citizens of the town, and of course the people who run this place, our volunteers, our director and our assistant director, we welcome you.
Good evening, everyone. I'm so pleased to be here and grateful for the opportunity to share my story with you all today. I, like many of you, have experienced many ups and downs with the healthcare system, and I'd like to share some of them with you today. I had very little experience with health insurance or doctors in hospitals until my son was diagnosed with MS in 1998. It was then that I began to realize what it was like for so many other people dealing with chronic illnesses. Little did I know that my experience with my son's battle with MS was only preparing me for what to come. My life was turned upside down in February 2003 when my daughter Pam was severely burned in the station nightclub fire. My family and I spent the following 3 months in the hospital at Pam's side. She received all the best care available, but sadly passed away in just 3 months and became the fire's 100th victim. This, as you can imagine, was a difficult time for me and my family. The medical bills for Pam totaled over $3 million. Thankfully, we were not responsible for paying them, but if we had to worry about that, in addition to taking care of her, I don't know how we would have done it. Not having to worry about medical bills allowed us to be there for Pam. Unfortunately, this is not always the case. It has certainly not been the case for my sister Tina. The statistics about the looming economy became a reality for Tina and her husband Jack when he lost his job and the $1,500 per month premium for COBRA was just not possible on top of mortgage payments, car payments, and groceries. Tina decided to opt out of the COBRA policy. After a few months of struggling and wondering what was next for them, Tina began losing weight. At first we thought maybe she was just having a hard time, but soon the weight loss became so significant that we knew something was wrong. She resisted going to the doctor and feared that medical bills would make their already difficult situation unbearable. One day she fell ill, so ill that we had to rush her to the hospital by ambulance. She's not here today to share the story with you because she died 3 days later. People get sick and die. I understand that, we all do. The tragedy here is that this didn't have to happen, at least not this way. When we were talking with the doctors at the hospital, we found out that her weight loss was a symptom of bone cancer and diabetes, and that she likely had a heart attack at home. All treatable conditions, and the doctors wondered why she was just coming to the hospital now, after it was too late to do anything about it. Suddenly, we looked around at our family and realized that the statistics and stories about health insurance and the economy were no longer just things that you hear about on the news. Our family was now one of those stories. This didn't have to happen, and we're all here today because we don't want things like this to continue to happen to our sons and daughters, sisters and brothers. Senators Whitehouse and Reid, thank you for having us here today and for listening to our stories. Please take our stories back to Washington and do what you can to make it so that other families do not find themselves in the situation my family did.
Thank you, Anna. It's such a powerful story and such a reminder of why dinner that I've hosted the 6th or 7th this year. And we always start with somebody who's had a personal experience, not from politics, but from a personal, from Rhode Island, who's had some personal experience to shed some light on one of the issues we're working on in Washington. And it's not easy to come up and tell a story like that. And it's not easy, frankly, public speaking at all. One of the things Americans are most nervous and afraid of. So for Anna to have shared that story and she got up in front of all of us to do so means a lot to me, and I just want to ask you all to thank her once more. I also want to thank Mayor Policina and the good folks of Johnston who are helping us with this event, particularly the Johnston Senior Center for hosting us tonight. It's a beautiful, beautiful facility. We don't often have chandeliers where we host these. A very nice thing, and I want to express my appreciation to the staff at the Johnston Senior Center for all their good work letting us in. Can we give them a hand? Today, for Senator Reid and for myself, is a day that is shadowed by this morning's news. For my entire life, there has been a Kennedy in the Senate. The first Jack Kennedy before I was born, Jack Kennedy. Today is the first day of my life that the United States Senate has not included Jack Kennedy. And I've had the chance to work with Senator Kennedy and see his passion for, see the respect his colleagues have for him. His most ardent opponents, people who disagreed with him violently on many issues, who came home and campaigned about being a voice against people like Senator Kennedy, admired him and appreciated him in the Senate because they knew a great legislator when they saw one, they knew a man of real passion and conviction when they saw one, and they knew somebody who was willing to reach out and help them across their disagreements. It didn't matter the disagreements were. He was a wonderful colleague who was a senator. And so for both of us as members of the Senate, this is a sad day, and it's also sad to think of our colleague who we work with very closely and admire very much, Patrick Kennedy. At any age. And Jack served with Senator Kennedy longer than I did, and what I'd like to do is ask him to say a few words about Senator Kennedy. He served both on the Health Committee and on the Armed Services Committee. Senator Kennedy was the chairman on the Health Committee, and to say a few words, I would appreciate it. And maybe he wants to say a few words about healthcare as well, and then we'll go right to questions. And our first questioner already picked out. But the routine on the questions, just so we'll go ahead, Jack. No. When the time comes for questions, we have people who have microphones here, and Karen has one right here, and Nick has one right here. So I'll ask you to put up your hands. I'll try to pick people around the room. I'll reach out to different groups. Can't hear me either. Ask a question. Do wait for the microphone to come to you, and do try to let me